Hello, and welcome to our home infusion instruction video. I'll be your guide as we walk through the steps of how to self-administer your infusion therapy. We know this can feel a bit overwhelming, but we will provide a detailed overview so that you'll feel comfortable and confident. As part of your home infusion team, we'll provide a personalized treatment plan to assist you on your road to recovery from the comfort of your own home. Our Care for Who I Am culture reflects our unique care model, which focuses on you as an individual to help improve your life in a meaningful way. Select a clean surface for your working area. Remove the medication from the refrigerator at the specified time on your medication label. Never speed the warming process by putting the medication in the microwave. Gather your supplies and stash instructions. Your IV medication elastomeric pump, 2 saline syringes, 1 heparin syringe, and 4 alcohol wipes. Check the medication label for your name, birthday, correct medication, expiration date, and amount of time needed to remove the medication from the refrigerator to warm the medication to room temperature. Wash your hands with soap and warm water. Then dry them with a clean towel. On both saline syringes and heparin syringe, remove the plastic wrapping, remove the cap, hold it vertically, and pull back on the plunger to loosen it. Once loosened, begin pushing the plunger to remove the excess air until you have a small amount of saline or heparin on the tip of the syringe. Then replace the syringe cap. Be careful not to touch the tip of the syringe or the inside of the cap. When finished with the syringe, place it back on the clean work surface. You are now ready to begin the sash process. Scrub the clave with an alcohol wipe for 15 to 30 seconds and allow to air dry. Remove the cap from the saline syringe. Attach the saline syringe to the clave by using a push and clockwise twisting motion. Once it is connected, open the clamp on the extension tubing and the PICC line if present. Flush the line with saline using a pulse or a push-pause method. If resistance is met, do not try to force it. Double check that all the clamps are open. If the clamps are open, call your nurse or pharmacist for further instruction. When the entire syringe has been administered, clamp the tubing and remove the syringe and discard into the trash. Be mindful not to touch the clave. Pick up the next alcohol wipe and scrub the clave for 15 to 30 seconds and allow it to air dry. Remove the cap from the elastomeric pump tubing. Attach the tubing from the elastomeric pump to the clave by using a clockwise twisting motion. Once connected, unclamp the tubing. Your medication will run over a specified number of minutes. If the elastomeric pump does not start to deflate, double check that the clamps are open. If all of the clamps are open and it is still not deflating, call your nurse or pharmacist. When the medication has been administered, clamp the tubing on the extension and the pump, remove the elastomeric pump, and discard it into the trash. Be mindful not to touch the clave. Pick up the next alcohol wipe and scrub the clave for 15 to 30 seconds and allow it to air dry. Remove the cap from the saline syringe. Attach the saline syringe to the clave by using a push and clockwise twisting motion. Unclamp the tubing and flush the line with saline using a pulse or a push-pause method. When the entire syringe has been administered, clamp the tubing and remove the syringe and discard into the trash. Be mindful not to touch the clave. Pick up the next alcohol wipe and scrub the clave for 15 to 30 seconds and allow to air dry. Remove the cap from the heparin syringe. Attach the heparin syringe to the clave by using a push and clockwise twisting motion. Unclamp the tubing and flush the line with heparin using a pulse or a push-pause method. When the entire syringe has been administered, clamp the tubing and remove the syringe and discard into the trash. Lastly, wipe clean the surface of your work area. Please monitor for signs and symptoms of infection. If you develop a fever, notice redness, warmth, drainage, or swelling around your PICC line, please notify us right away. If you develop wheezing, difficulty breathing, or swelling of your face or tongue, please call 911 or report to the nearest emergency room immediately. If you develop a rash or hives, please contact us right away. IV antibiotics may cause loose stools and stomach discomfort. If you experience this, discuss with your healthcare provider. Please do not soak or submerge your PICC line dressing. We provide a plastic shower sleeve for your convenience. If your PICC line dressing gets very wet or starts to peel away from your skin, please notify your pharmacist or home health nurse as soon as possible. Our pharmacy team will be contacting you weekly to follow up and verify all of the supplies that you may need. Please keep your supplies in one location for easy inventory purposes.